Hi everyone, my name's Rowan, and this is my policy options video on the prison needle exchange program. We're going to be looking at some examples internationally, and we're also going to be looking at some recommendations and options that Correctional Service of Canada can implement to help better their own program. So, just a quick overview of Canada's current policy. Um, HIV and HCV individuals are overrepresented within Canadian prisons, as there's a 10 times higher rate of HIV than the general population. A lot of the times, offenders use handmade equipment and share this equipment with other offenders to use drugs, which in turn increases the risk of infectious diseases transmission. The goal of the needle exchange program is to provide sterile needles to inmates through healthcare staff and to limit infectious diseases transmission like HIV and HCV. Expected outcomes include reducing sharing needles and contraband, as well as facilitating referrals to treatment programs, and to decrease bloodborne infections, as well as infections that occur on the skin from needle usage. Canada's policy has been critiqued as they have had a low user rate. And some of these barriers include the stigma against drug users, as well as confidentiality issues. From a global aspect, programs like these have had a record of being poorly implemented within prisons. There's been gaps between UN recommendations and ground level implementation. Only 60 out of 10,000 plus prisons worldwide have programs similar to these. Countries like Switzerland, Spain, Moldova, Romania, and Portugal have current programs or has had programs in the past for needle exchange. And at the end of the day, Canadian offenders have a legal right to the same health care that the rest of the population have access to. Sweden was the first country to implement any type of needle exchange program within their prisons. Currently, they find that there is no increase in drug use when prisoners are given access to these types of services, with a near elimination of shared equipment and no weaponization of the syringes as well. They utilize retractable syringes that are one-time use, which assists in safety needle prick injuries. The program process includes screening, equipment request, system utilization, medical consultations, and education on harm reduction. In Portugal, there was a pilot that was instilled in 2007. After 6 months of low participation, they wrapped the program due to the fear of discrimination by prison authorities. So in Germany, there were two methods of distribution used, one using a vending machine style, and then the other staff facilitating syringes. A few minor violations occurred with syringes not being stored in designated areas, but there were a high return rate of needles. They saw some positive outcomes, including increased referrals to follow-up treatment and drastic reduction in used needle sharing, and no new HIV or hepatitis infections reported. At first, staff were quite weary of needles uh, offenders possessing needles. But after they saw the results, they 80 to 90% of staff were on board with the program. They also found that there was a decrease in overdose cases, and they found that the feasibility of this program was easily integratable into daily routines. And education was also a major component of the program. So in Moldova in 1999, they authorized a syringe and needle pilot project, and initially managed by prison medical staff, offering safe injection materials, condoms, and harm reduction information. Some early obstacles occurred, including low uptake of the program and barriers including fear of harassment and lack of trust and confidentiality, as well as limited access to the program. Uh, a solution was to utilize a peer based exchange model where prisoners volunteered as outreach workers and were trained to distribute supplies and directly into living areas. This came with 24/7 access to these types of materials. At first, a lot of the prison staff were opposed to this idea, but after viewing results, there was a positive shift in perspective. This model was then expanded into 20 other locations across Moldova since the 1990s. Regarding alternative policy options, here are four methods of needle exchange distribution. The first is a syringe dispensing machine that we saw in Germany. Uh, some advantages of this method includes high degrees of accessibility. Often, several machines will be placed throughout an institution, and they are available for 24/7. There's a high level of confidentiality as there's no involvement with correctional staff. There's also a high level of acceptance by prisoners, and there's a strict one for one exchange uh, regarding syringes. Some disadvantages that come with this method include that the machines are vulnerable to vandalism by prisoners or staff who are not in favor of the program. Some technical problems also can occur with the functioning of the dispensing machines. Some prisons are uh, unsuited for the use of dispensing machines. For example, lack of discrete areas to use the machines. Some machines need to be custom designed, which can increase the cost, as well as this is a pure technological solution with no opportunity for counseling or referral. With the peer support model that we saw in Moldova, there was a high level of acceptance by prisoners. There was also a high degree of confidentiality and trust within peers. And this model also makes it easier for prisoners to access harm reduction measures like condoms and other paraphernalia. And this also gives the opportunity for these volunteer peers to educate their fellow prisoners that are using drugs on how to safely consume drugs and also be referred to um, rehabilitation programs. There's no direct staff control over this method, which can lead to an increase of fear about the workplace safety. There was also an opportunity for volunteers to blackmail other prisoners um, by disclosing information about their drug use. There is also a chance that volunteers may sell syringes as well for financial gain, and selected prisoners may not provide reliable services for fellow prisoners, possibly by demanding goods or services in return. Regarding non government organizations, there are some advantages to that, which include provides a higher degree of confidentiality as prison staff are not directly involved with the program. It facilitates outreach to and contact with previously unknown drug users that may be more comfortable coming forward with a non-government organization. Also, a there's a one-for-one exchange or multiple syringe provisions are available. Some disadvantages include syringes only being available for a set amount of hours or times a week when the organization can attend the facility. Uh, confidentiality may be compromised by policies that require the external agency to report to the correctional service, and other external workers may experience more barriers in dealing with the prison bureaucracy than internal prison health. And there also could be some staff issues with the organization as well. Lastly, we have prison healthcare that provides the syringes and the program similar to the Correctional Service of Canada. Some advantages include it allows for personal contact with prisoners and an opportunity for counseling. It can facilitate outreach to contact with drug users, and it also maintains a high degree of control over access to syringes. Some disadvantages include limited confidentiality, may reduce the participation rate, which the Correctional Service of Canada has certainly experienced. Access could be more limited as syringes are only available during established opening hours of the health service. And it also creates a possibility of proxy exchanges by prisoners obtaining syringes on behalf of other offenders that are not willing to participate in the program. Uh, so, prison needle exchange programs are, in general, quite cost effective if they're well designed. Some direct costs include syringes, needles, related paraphernalia, injection equipment, cases for syringes, and safe sharps disposal containers. It costs approximately $6,500 per dispensing machine, and additional maintenance costs as well. And then there are also other indirect costs like healthcare staff and non government organization contracts as well to consider. So I recommend that a vending machine style distribution method within private areas to be used within a correctional environment, as it provides access to um, uh, offenders 24/7 access as well as private access too. And I would also implement a non government organization or a separate organization that is not a part of the Correctional Service of Canada to be involved with um, gathering information from the machines, which offenders are utilizing the service, and how often they utilize the service as well. I also would recommend that the Correctional Service of Canada utilize retractable syringes as they reduce the risk of needle sharing and reuse, and they also reduce the risk of needle prick injuries. Uh, Education through prison healthcare of the uh, non government organization is also extremely important. There's limited confidentiality when prison healthcare is involved. which is the case for the Correctional Service of Canada and what they've seen with the rates of usage of the program. Uh, in this case, the NGO can provide information to health services only when needed, so the confidentiality remains as strong as possible. Using the peer offender method sounds like a good idea for sure, but it can lead to security concerns. It can lead to more power dynamics between offenders themselves, and it may be difficult to ensure consistent and unbiased distribution as well. It is vital that regular evaluation and monitoring of the program occurs to ensure its effectiveness and to make necessary adjustments when needed. So there is an immense need for prison needle exchange programs within institutions, as there's a high HIV and HCV prevalence among Canadian inmates. Uh, the program currently faces low participation due to risk of stigma and confidentiality concerns. Key findings include a successful program prioritize anonymity and accessibility, with no increase in drug use or safety risks reported. My recommended policy, which is a hybrid approach with vending machines and non-government organization overseeing and facilitating the program, is the best way, in my opinion, to uh, increase the confidentiality of prisoners while also maintaining high accessibility levels. And this program aims to reduce HIV and HCV transmission and increase harm reduction participation, as well as to improve inmate health outcomes. Thank you for watching.